This episode of the Practice of Therapy podcast is brought to you by TherapyNotes. You can find out more about them by going to practiceoftherapy.com/therapynotes. And also brought to you by the Practice Launch Club, an exclusive membership community for those in private practice or getting started in private practice from the Practice of Therapy. Find out more about that by going to practiceoftherapy.com/launch club. Hello, I'm Gordon Brewer, and welcome to the Practice of Therapy podcast, where we explore the business and clinical sides of running a private practice. Hello, folks. This is Gordon Brewer, and welcome to the Practice of Therapy podcast. And this is episode number 237 of the podcast. And if you're joining us for the first time, glad you've stumbled upon us or found us, and hope you'll share what you find with others. And be sure to take time to follow us wherever you might listen to your podcasts. I'm looking forward to you hearing my interview with Maryellen Dance. Maryellen was such a delight. She is so enthusiastic, and these are exactly my conversation with her is exactly the kind of conversation I love to have, and just appreciate her sharing her practice journey with us and going from a solo practitioner to starting a group practice. And we talk about hiring interns and all of that kind of good stuff. And it was just a fun conversation. I really enjoyed getting to know Maryellen. One of the things we talk about in here, and I want to mention this because it's kind of relevant to this episode, is we talk about going from solo to group practice. And one of the things I want to make you aware of is that I've got a free webinar that I did with my good friend, Dr. David Hall. And you can find that by going to practiceoftherapy.com/webinars. And there is a webinar that we did together called Scaling Without Failing. And it's a free webinar, and I would invite you to take a look at that if you're interested in going from a solo practice to a group practice. And be sure to watch. It's an automated webinar, so you get to pick the time that you get to see it. So I want to commend that to you as a resource that's out there for you. And also, before we get to my conversation with Maryellen, I'd love for you to hear more about TherapyNotes.
As your practice grows, the systems and processes you have in place will keep your practice running smoothly. That is why it is important to have an electronic health record system that is specific to mental health providers. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. They are who Gordon uses in his practice. And did I mention that they are one of the top-rated EHRs for mental health private practices? Their support is also second to none. Be sure to check them out at practiceoftherapy.com/therapynotes. Be sure to use the promo code GORDON to get 2 months free.
Well, hello, everyone, and welcome again to the podcast. And I'm really excited for you to get to hear from Maryellen Dance. And in just a little bit of time we've chatted here at the beginning, she is a good one. I can tell you that. So, Maryellen, welcome to the podcast.
Thanks so much for having me, and thanks for the endorsement.
Yes. So Maryellen, as I start with everyone, why don't you tell folks a little bit more about yourself and how you've landed where you've landed in your private practice?
Yeah. So it's been kind of interesting. And I always joke that I kind of accidentally started a private practice and I accidentally hired people. um, so I worked after grad school, I worked in clinics, I worked in hospitals, kind of the typical gamut. And oops.
It's okay. It's okay. They're welcome.
And so I got a job when I was 26 years old. I got a job as a manager at a clinic. I was a manager of a home and community-based services program, and I was managing 55 people, and I was in way over my head. I was miserable. I hated it. Again, I'm 26 years old. I didn't know what I was doing. When they hired me, the company kind of, they had these ideas to like mold me. And then I got there and some things happened with the company that they just didn't have the time or capacity to mold me. And so 6 months into that job, they asked me to resign.
Wow.
Yeah. They asked me to resign. And it was, as a 26-year-old, it was terrible. And they said to me, you haven't done anything wrong. You have done nothing wrong. You're just in over your head, which was accurate. And I'm like, but you knew that when you hired me. But so my confidence was shot. So that was in June of 2017. So in June of 2017, I get asked to resign. My confidence was shot. That by the next day I had applied for like 40 jobs or something. Like I was, and so that summer I applied for, interviewed at, got 8 different job offers, 8 different offers, all in like clinics, that type of thing. And every time I got a job offer, I would call my mom crying. And I'd be like, oh, it just feels like I'm going back into the belly of the beast. And I don't want to go back into the belly of the beast. So every time I got a job offer, I would call my mom crying. And so September of that year, so after a few months of this, September of that year, I was like, I'm going to stop applying for jobs. I am going to start a private practice. And if it doesn't work, I now know I can get a job. I'm hireable. I got job offers, so I can get a job. So I told my parents, I was like, all right, give me 6 months. And if it doesn't work in 6 months, I'll go get a job. We've already found out I'm hireable. And so they were like, okay. And within 3 months, I had hit the goals that I had set for myself for the first year of the business.
Wow.
So
this was like 2018, 2019, or
that was 2007. So September 2017 is when I stopped applying for jobs and when I opened my doors. And then so I did that for a while, and then around September of 2019, I started hiring therapists.
Wow.
So it was just me for about 2 years, maybe a little over 2 years. And then I started hiring therapists. And so now I have 8 therapists that work in the practice. Yeah.
Yeah. So it's and I think that's a typical journey for a lot of folks, and that they, did you think you would ever want a group practice when you first started as a solo practitioner?
No.
Yeah.
No. I still don't know if I want a group practice.
Yeah. Isn't that funny? I mean, isn't that funny how that works? Yeah. So, I think that's how it usually goes. So, So what are you learning so far about just being in private practice and doing all the stuff that you're doing? I know that's a broad question.
Oh gosh. So, a lot. So I've learned that I really like the business owning aspect of it. Like I really enjoy, which I never thought I would enjoy, but I really enjoy looking at marketing and, how can we improve? And I'm not really a numbers person. I mean, I'm a feelings person, but I still like looking at like, let's look at like growth and just some of that nitty gritty stuff that I never thought I would like. I really, really enjoy. I love being able to just be a therapist.
Yeah.
I love being able to just see clients. I feel like so I hired my first therapist like fall of 2019. And so by March of 2020, I only had 2 therapists working for me. So then obviously COVID hit, and then it's been kind of a whirlwind and we've grown really fast. So I still feel like I don't know what I'm doing at all. Like I definitely have imposter syndrome practice because it kind of blew up so fast because then there was such a need and all of that. So I still feel like I'm learning every day, but I also like that because it's fun. And I love having the group practice because we can learn so much from each other. And, it's lonely. Being in private practice is lonely. People don't tell you that, or maybe people don't realize that. But it's really lonely. And so that's another, really nice thing about the group practice. Another thing that I love about the group practice is I love that we're kind of a family practice, right? So, it's very common that I'll be seeing a mom while another therapist, is seeing the teenage daughter or things like that, which I love, like just being able to provide that kind of one-stop shop. Like, here it is. It's easy. I love that.
Right. Right. Yeah. So what would you say have been the big challenges for you as over, making that transition from, again, a typical story, people just get overwhelmed with working for an agency or, some sort of public entity and then go into private practice just because, as much as anything, because of the autonomy it gives us and just all of that sort of thing. What have been the biggest challenges that you've been able to kind of overcome through all of this?
Well, it's kind of, it kind of changes as I change, so initially the biggest challenge was, how can I ask people for money? How can I do this? How can I actually build a business off of this? Like, how is that possible? So that was kind of the first big challenge that I overcame. And then the next kind of big challenge I overcame was, I'm hiring people. What do I do with them? Will I be able to give them clients? Like, will business keep coming? What if it stops? Like, now I have these people depending on me, where before it was like, okay, if I fail, I can kind of just like secretly fail, Now it's like these people are depending on me. And now the kind of current challenge I'm facing is, okay, how can we be the best? How can we just continue to be doing good for the community and treating our clients in the best way we know how and be our best versions of ourselves and as our therapists and things like that.
Yes. What tools are you using to help your staff with that, as far as developing those values and being the best?
Lots of CEUs, lots of educational training, lots of group supervision, lots of connection, honestly, is the biggest thing. Because, at the end of the day, CEUs, any type of professional development, are really helpful. They're really helpful. They're really knowledgeable. But the things that like ignite me are conversations and, bouncing around ideas and things like that. That's what like fuels the fire inside of me.
Sure. Yeah. That's and so in many ways we were talking, you'd mentioned supervision, and you and I had both had talked a little bit before we started recording about working with interns, and I think a lot of times people in private practice, that particularly if they have a group practice, miss out on an opportunity to have interns in their practice and work with them. So how did that happen for you, and how did that all come about? And, what sort of systems do you have in place for that?
So I love having interns. I love interns because they are so excited. They are so ready to learn. And they're kind of moldable a little bit, they haven't learned bad habits yet.
Right.
So I love that. So I have good relationships with a few of the, grad programs, where I live. And so being able to have good relationships with their on-site school supervisors and then the clinic is just so valuable. And so with interns, it's really fun. Like, I just find it really fun. Like, and I find, they always say that like teaching helps you learn. So like, I feel like it keeps me honest. It keeps me kind of up to date with things.
Yeah.
And, I think it helps me as much as it helps them.
Right. Yeah. And I think there's a great, I think as far as the opportunity for those in private practice, I noticed when I was kind of cruising your website that you do things pretty much in the same way that we do, in that if one of our interns sees a client, we're able to offer to the client a reduced fee. Mm-hmm. And so I think that's appealing to people, but also, a great idea that you had, that you did on your website is to have a blurb on there for the public about what it's like to work with an intern. And I think that, explaining what supervision is and how all of that works, rather than, trying to pretend like it's, it's not a thing. So, yeah.
Right. Well, and it's hard because so many people, and I get it, but they hear the word intern and they're like, oh, nope. Like, no. Mm-hmm. So I get that. Mm-hmm. And so I just want to make it clear. And I very much prescribe to the idea of let's be transparent as possible. Right. Mm-hmm. So and I think people appreciate that. I hope people mm-hmm. appreciate that transparency of this is where they're at and we can offer you this reduced rate, and great.
Right.
Plus it's also good because a lot of the time I like to hire on interns afterwards. Mm-hmm.
Yes, yes, absolutely. And I've had a lot of success with that as well. The last few people that I've hired have actually been, because, I'm sure you're running the same thing. Finding fully licensed people is kind of hard right now. Yes. Because the demand is so high in our field and that sort of thing. And so I think, it's kind of a win-win in that you give the intern an opportunity to learn from you and to be able to, kind of get their sea legs with just being in practice, and then being able to, kind of raise them up, so to speak, in your practice, and really kind of develop them in that way. Yeah.
Yeah. Well, and it's also so I had an interesting kind of journey with grad school and my internship. So I was a substance abuse counselor mm-hmm. with just my bachelor's degree. So for the 3 years I was in my master's program was 3 years. And for the 3 years I was in that program, I was a drug and alcohol counselor. I was a substance abuse counselor, which was amazing in a lot of ways, mm-hmm. but also, exhausting, I should say. Mm-hmm. It was also pretty exhausting. And it was, I wasn't able to do my internship there. So for a year, I was 40 hours a week as a substance abuse counselor, 20 hours a week. I was doing an internship at a domestic violence shelter. And then I was still going to classes. And so I feel like that time of my life was like such a whirlwind. Mm-hmm. And at the time where I was doing my internship was very understaffed. So I wasn't really getting great like supervision. So it was a wonderful experience because it's made me the counselor I am today. Mm-hmm. But also I think it's taught me of like what I want to do differently, what I would have liked differently. Mm-hmm. Does that make sense?
Yes, it does. It does. And so I think, just kind of thinking about our own kind of learning experiences and how we can make it better for those that are coming to us as interns and that sort of thing. Yeah. Right.
Yeah, absolutely. And we need good therapists. We need good therapists out there.
Right.
I don't think that need is going away anytime soon. Right.
Well, one of to switch gears just a little bit, Maryellen, I know one of the things, again, when I went and looked at your website and just looked at, again, kind of putting on that private practice consultant hat of looking at people's branding and all of that kind of stuff. You've done a wonderful job of branding your practice. And And in particular, it really ties over well with the podcast that you have. So I want you to tell folks about that and kind of your philosophy behind that and where that's taking you.
Yeah. So, okay. Where do I start? So when I was successful in my private practice early, right? Like the amount of clients I wanted to see a week, my goal, I got to pretty quickly. And the only reason I think I got there is because I think I'm nice and friendly. And like, I mean, I think I'm an okay therapist. I think I'm decent. I hope to be a good therapist. That's my goal. But I don't think that that's the reason why I got successful in the first place. I think it was being nice, being welcoming, being, like good customer service kind of thing. And so that was really important to me with hiring people on. Like I want us to be real people. Like I am very real. Like I often will sit with my leg up and, talk about my dog, like things like that, like very real. And that's really important to me because I think people connect with that. It makes it less scary. It makes it less like daunting. And so, so with that being said, I started about almost 2 years ago now, I started a podcast called the Okay-ish podcast. Because at the time, that term toxic positivity was starting to kind of come out, and self-help was rampant. Self-care, the term self-care was rampant. And I really struggle with that term. And I was like, no, like we're looking at this wrong. Like we're not trying to be perfect. We're not trying to be self-caring our way out of things. Like that's not how mental health works. I'm not trying to be perfect either. Like I'm just trying to be okay-ish. And so that's kind of like where that idea came from.
Right. Well, it's the theme of just making people comfortable with talking to someone, and the other part of it too. And this topic has come up several times on the podcast, and just the amount of self-disclosure that therapists do with their clients. And that I think that when you kind of share with your clients kind of your own struggles in life, it gives you a little more credibility. I mean, it's not like you're pouring your guts out to them like you would with your own therapist, but I mean, it's just really, really just saying, I get it because I've struggled with that too. That just goes a long way in just building rapport and just really building that therapeutic relationship.
Well, and I think, I think one of the things that I'm really, really proud of myself for, the best compliment I ever received from a client told me, she goes, I don't really know that much about you. Like, I don't really know, like, I know you have a dog and, like some random things. She was like, I don't really know that much about you, but I feel like I know you really, really well. Because I am like, how I'm talking right now is how I talk in session. It's how I talk to my friends. It's how I talk to my family. Like, I don't really filter, right? I don't put on like a therapist hat. Maybe the content of what I'm talking about is slightly different. But I still will be like, oh my gosh, did you see The Bachelorette last night? Because I'm really pissed off about it. Like I'll still do that. And I think that, people know that I'm a human. And it's also, it was tough starting the podcast because I realized that I was putting myself out there more. Like now, if clients chose, they would learn more about me. And so that was really, really vulnerable. I think that the profession of therapy is changing. Like when I was in grad school, they talked about self-disclosure a lot. And now, granted, I don't do that type of self-disclosure in the therapy room, but with social media, the city I live in is not very big either, right? So like it's people know people and things like that. I think that it's changing a little bit, and that it's not so frowned upon that, some of my clients probably listen to my podcast and I'll share things about myself there. And I don't think that's doing anything bad.
Right. Well, it makes the number one thing that makes therapy efficacious is the client therapist relationship. I mean, that's just, that's kind of, in many ways, it's kind of, I'll go out on a limb and say it's kind of set in stone, but there's, the data to back that up. But yeah. And so I think being real with people and just being yourself just goes a long way with everything. It not only makes you a better clinician, it's just better for your business in that sense.
Yeah. Well, and I talk about a lot how the client therapist relationship is such a unique relationship. Like, I feel like there's no other relationship like it. And it's just awesome. Like, it's just so, I mean, that's why I do it. Like, that's why I do it, because of those relationships. It's amazing. It's really, really, it's really honorable to be a part of.
Yeah, I would totally agree. Totally agree. Tell folks more how they can how they can reach you and where they can find your podcast and all of that kind of stuff.
Yeah, absolutely. So my podcast is called Okay-ish, OKAY-ish. And it's on wherever you stream podcasts. My therapy practice is called Pittsford Therapy. The best place to find anything, though, my name is Maryellen Dance. If you go to MaryellenDance.com, it's kind of like a hub of all these things. It links to everywhere you need to go.
Yes. Well, Maryellen, any parting thoughts for folks that are listening?
Well, I just want to say that I really appreciate you doing this podcast. I appreciate you having me on and being a part of it. But doing the podcast, I think it's so helpful. I know it's been helpful for me to listen to, because I do feel a little bit siloed, right? And so to listen to other therapists' journeys and, how you can relate and how you can learn from, it's just, I think it's so helpful.
Yes. And that's my experience too. There's something, I don't know. It's probably a little bit false or pretentious, or I don't know what's the right word there. But when you're listening to a podcast, it's just kind of personal because it feels like you're really just having a conversation with that person. So So I'm glad you're doing podcasting, because I think you're probably helping a lot of people that you don't realize you're helping. Thanks again, Maryellen, for being here. And again, we'll have links in the show notes and show summary for folks to get in touch with her. Well, I'm so grateful to Maryellen for being on the podcast. And this is, as I said earlier, this is exactly the kinds of conversations I love to have. Just people talking about the things that they've learned and struggles they've had along the way with being in private practice, and then being able to share that through our conversations here on this podcast. And be sure and check out Maryellen's podcast, Okay-ish. I've got it on my playlist to get to hear next. But anyway, be sure and check that out. And you can go to MaryellenDance.com and find out more about all of her stuff and her practice and that sort of thing. And also, just kind of while we're on the same topic of having conversations, if you think you would like to be on this podcast and would like to share your private practice journey and share what you've learned along the way, I'd love to have you as a guest. And you can go and apply at practiceoftherapy.com/podcast, and you'll see a link there to fill out the form to possibly be on the podcast. So we just want to put that invitation out there to you. And also, as I mentioned at the beginning, I'd love for you to check out the Scaling Without Failing webinar, and you can find that at practiceoftherapy.com/webinars. And that's a free automated webinar that you can watch. You get to pick the time that you watch it. And it's really kind of goes into some of the nitty gritty about going from a solo practice to group practice and things you need to have in mind. So anyway, that's there for your viewing pleasure. And also, again, big thanks to our sponsors of the podcast. TherapyNotes. They're who I use in my practice, and I'm so grateful for their support of this podcast and the work that we're doing here. And you can find out more about them at practiceoftherapy.com/therapynotes. And when you go there, be sure and use the coupon code just Gordon, Gordon, and you can try them out for 2 months for free. And also the Practice Launch Club, which is a new exclusive membership community for those people in those beginning stages of private practice. So check it out at practiceoftherapy.com/launch club. And so looking forward to you being with me in future episodes. Have a great week or rest of your weekend, whenever you might be listening to this. And take care, folks. And be sure to follow us wherever you listen to your podcasts. Thanks for being with me on this journey. You have been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free Private Practice Startup Guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.